Hello and welcome to this introduction of the Missed Opportunities for Vaccination application. I'm Caitlin Clary with Biostat Global Consulting. This is the first in a series of videos to orient users to this tool. A missed opportunity for vaccination, or MOV for short, occurs when a child has contact with the health system and does not receive all of the vaccinations that they are eligible for according to the vaccination schedule in their country. MOVs can be studied in several ways. One approach is to use data from a vaccination coverage survey. The World Health Organization has developed freely available software to analyze vaccination coverage surveys. That software is the Vaccination Coverage Quality Indicators, or VIQI for short. We'll be talking about the MOV measures that are currently implemented in VIQI in this video, and you can read more about those measures in the VIQI documentation, which is available online at biostatglobal.com/viki_resources.html. This link is also in the video description below. VIQI is designed to be extensible, so additional MOV measures will likely be added over time. The purpose of this introductory video is to provide definitions of MOV-related terms, to give an overview of what VIQI calculates, and to help the viewer understand which MOV output can be navigated using the Shiny application that we've developed. Using coverage survey data, it is possible to study a subset of missed opportunities, MOVs that occur when a child visits a clinic and receives one or more vaccines, but doesn't receive all the doses they are eligible for. These MOVs that occur at vaccination visits are sometimes called missed opportunities for simultaneous vaccination, or MOSV. For instance, if a child visits a health center and is eligible to receive 2 doses, Penta-3 and MCV-1, but only receives MCV-1, then that child had a missed opportunity to be simultaneously vaccinated for Penta-3. The coverage survey data tells us that the child had a health center visit on the day that they received MCV-1, and with that information we can determine that the child had a missed opportunity to also receive Penta-3. Coverage surveys don't capture every single time that each child has a health system contact, but they do capture vaccination visits, which lets us identify MOSVs. If a child misses a dose at one health center visit, but eventually gets that vaccination at a later visit, we say that the missed opportunity was corrected. On the other hand, if a child misses a dose and does not receive that vaccination at a later visit, at least by the time of the survey that collects this child's vaccination history, then the MOV is uncorrected. There are 2 methods of counting MOVs. In what VIQI calls the crude dose method, every dose counts even if it's received when the child is too young. Early doses are not expected to be re-administered when the child is older. In what VIQI calls the valid dose method of accounting, on the other hand, early doses do not count, and we expect the health clinic to repeat those doses later. In fact, VIQI counts it as an MOV if they miss an opportunity to revaccinate the child when they reach the appropriate age. In addition to getting to grips with this MOV terminology, it'll also be useful to understand VIQI's nomenclature for geographic survey results. A stratum is a unit of analysis where survey results are meant to be representative of the population. The plural of stratum is strata. The next few slides will introduce VIQI's terms for geographic strata. You can also take a look at Annexes A and B of the VIQI User's Guide for more detail. This slide shows health districts in the fictional country of Harmonia. VIQI describes something called Level 3 strata as the smallest geographic level where survey results are designed to be representative. So if our survey were conducted to be representative at the health district level, then these 10 health districts would serve as our Level 3 strata. Those Level 3 strata are often nested inside larger subnational strata, like regions or states or provinces. In our fictional country of Harmonia, districts are nested within the northern and southern provinces. These subnational aggregates are called Level 2 strata. And finally, in many cases, all of the strata can be aggregated to produce representative results at the national level. All the survey strata grouped together comprise the Level 1 stratum. There's only one Level 1 stratum in a VIQI analysis. Next up, we'll summarize the MOV indicators that Vicky calculates. The World Health Organization's 2018 revised manual on vaccination coverage cluster surveys describes two types of MOV analysis: visit-based and child-based analyses. The WHO manual is available at the URL on this slide, and the link to the manual is also in the description of this video. The MOV application that is the subject of this series of videos summarizes results from the child-based analyses. To put those results in their proper context, though, I'm going to briefly talk about both kinds of MOV analysis. In Vicky, visit-based analyses analyze the dose dates from vaccination records and summarize the proportion of vaccination visits that include an MOV. Results are calculated dose by dose and for all doses combined. The indicator calculates the number of MOVs per vaccination visit, as well as the number of visits a child has on average before they experience an MOV. Those results are calculated using the module that Vicky calls RIQUAL08. Vicky produces a set of tables and figures to summarize these results. Another visit-based category of MOV analysis asks what vaccination coverage would be if every child in the dataset received every dose they were eligible for at every visit recorded on their vaccination record. In other words, how much would vaccination coverage increase if there were no missed opportunities for simultaneous vaccination? This output comes from the indicator called RIQUAL07B. And again, Vicky produces tables and figures to summarize this output. As I mentioned earlier, the visit-based output from RIQUAL07B and RIQUAL08 is not the focus of our interactive MOV tool. Instead, the application described in this video series is designed to work with output from Vicky's child-based MOV indicator called RIQUAL09. The child-based analyses summarize the proportion of kids who experience MOVs at vaccination visits. Vicky calculates the proportion of kids who experience corrected MOVs and uncorrected MOVs, and the proportion of kids who are vaccinated at the first eligible opportunity for each dose. For kids who experience corrected MOVs, Vicky also calculates days to MOV correction, the number of days the child spends unprotected or underprotected between the first MOV and when the child eventually receives the dose. And then across all doses, Vicky calculates the proportion of kids who had all their MOVs corrected, the proportion who had some of their MOVs corrected, and the proportion who had none of their MOVs corrected by the time of the survey. The Shiny application that we've developed lets users interactively explore the results of the child-based analyses in every geographic stratum and for every vaccine dose. The application is available online at this URL, biostat-global-consulting.shinyapps.io/MOV_tool_public. That link is also in the video description below. In the next video, we'll open up the MOV application and begin to explore some results. This video mentioned these resources: the Vicky documentation, the WHO manual, and the MOV application. All those links are on this slide and in the description underneath this video. Thank you for listening, and I'll see you next time when we'll open up the MOV application and start to explore.